So, how do you actually get your research into practice? I'm just share my screen and share some slides. Should be said, when I do this session, I normally do it over probably an hour and a half or 2 hours, and it can be quite practical. So we're going to whiz through some stuff, and bits and pieces have been cut out of it. So hopefully this will make sense. I can take questions at the end, but if there are any points of clarity or something, can you shout, please? Because I can't see audience or any hands up or anything at the moment. So here are some practical tips, tricks, things to think about. They are grounded in academic implementation science, but you won't find the academic implementation science today. That's a challenge for you in itself. So what we're going to talk about today is lots of kind of things that I always talk about: what, why, how, who, so what, and when. So what is the thing that you're hoping to change as a result of your work? Why are you making that case for change? How are you going to implement that change? Who is your audience or your customers or your clients? So what? Why should they do something? And when do you know it's ready to implement? So it should also be said as a bit of a health warning, there is no right or wrong way of doing it, implementation. So lots of it is a bit trial and error and just keep having a go. But there are some basic rules or some laying the foundations for how we do this. So it's really important to keep this in mind. So every intervention has two different components. What do we want people to do differently, or the what? And how are we going to change people's behaviour, or the how? So when you start talking about operational implementation or designing in your implementation or thinking about your implementation process, what you need to focus on is finding your what and the who needs to do the what. You also need to do some work assessing the barriers and facilitators to do the what. That's why we do process evaluations quite often, and also thinking about how you select your change strategies, or the how. So in order to achieve your significant outcomes, you need an evidence-based what, effective change strategies, so your how, an enabling context, so the where or when, and high implementation quality. This is what people quite often think of as the adoption process or the implementation process. Can also be referred to as like a translational gap. So you've from left to right, you can identify your gap, you can create something, you can pilot it, you can launch it, you can adopt it, it becomes embedded or normalized into normal practice, and then you do a post-implementation review. This is probably what it feels like for most people. So a series of convoluted turns, decisions, flows, and then that bit at the end where it just happens. We don't really know what happens. And this is also what it can feel like. This is exactly the same journey that we saw in that linear left to right map a few slides ago, but it's a bit more realistic about what that process can be like. It's got diversions, it's got potholes, it's got roundabouts, it's got traffic lights, it's got stop go signs, it's got one-way signs that get implemented suddenly. So it just shows you that implementing change into practice isn't a straightforward thing, certainly isn't linear, regardless of what quite a lot of the evidence background says. It's just tricky, and it is your job to try and understand that map and navigate yourself through it. So when we implement change, there are some more ground rules. And these are some really key terminology that's really important for you to get to grips with and use. So implementation is a process or an effort by which evidence is put into practice. It will always involve a change in processes or behaviours. It's recognised, and this is a bit sociological, as the dynamics of agency or doing something different under conditions of constraint. And that one sentence there kind of suggests to you about the whole, it's about human behaviour and human action. And that's some of the reasons why people and systems are reluctant to implement or to accept the implementation of change. So when we talk about implementing something, so an intervention, or evidence or innovation, it's not only the intervention that's important, but the related practices, beliefs, behaviours, or what somebody called interconnected bundles of stuff that are all crucial to understand. And it's our job as those implementation specialists to understand those and to kind of be a detective and work all of that out. So there are some more things you need to consider. These are all kind of the same, but this is just shown in a different way. So what is your innovation? What are the implementation challenges? Who or what does it affect? How do we improve the implementation? How do we know if implementation is successful? And what are the desired outcomes? The implementing change, like any action, always requires a plan. And when we play games, we always have a strategy or plan, don't we? So when I play Connect Four with my daughter, it's always a fight to see who gets to put that red coin in the middle. Because if you get that one, you're most likely to win. Implementing change can be described in many ways, as this slide shows. Over the years, we've talked about adoption and spread. We've talked about implementation, translation, knowledge exchange, transfer, impact. At the moment, we talk about knowledge mobilization, but what it's clear, regardless of the terms you use, is that it is highly complex, it's messy, it's non-linear, and it's inherently tricky regardless of what you are doing or what you are trying to implement. So we talk about implementing change as a zone of complexity, a bit like a maze. You need technical and adaptive skills to survive, let alone thrive. And even then, it's never straightforward, and it's never the same every time. But don't give up. So why I said you needed a piece of paper in front of you for a very quick self-reflective activity. I want you to think about two questions and write your answers down really quickly. So what do you want to do? What is the thing that you are trying to implement? And why do you need to do it? So what is the gap that you're trying to fill? So one of the first challenges to solve is working out what you're actually trying to implement or what that thing is. So within Arc East Midlands, I spent quite a lot of time working with our research teams. And I always ask them this, and it can be really tricky to break down what is the thing that they are wanting to implement. Is it the trial that they're doing or the research study they're doing? Is it the intervention? It's probably the intervention, but it might not necessarily be the whole of it. It might just be certain parts of it or a byproduct of it. So you also need to acknowledge that different things in the way, the differences in the way different things mean we have to implement them. So we use implementation strategies to describe the activities that we're trying to do and help people, but they won't be the same thing or the same way of doing something each time. They could even be different things for the same intervention in different places. And then our implementation outcomes show us how much our product, our thing is being used, or how well people or organisations are using them after your implementation efforts have stopped. And that's what we really want to know is after we've walked away as researchers or improvement practitioners, are people still going to use the thing that we have asked them to use? So thinking about those two questions you've answered, another question now is, what is your thing? So what is the thing you're going to put into practice? How are you going to get it into practice? And what are your desired outcomes? So probably most of the things or the interventions or the products that we will create as researchers can fit into one of the 7 Ps, be they programs, practices, procedures, policies, product, pills, or principles. For us at Arc East Midlands, we tend to refer to the idea of products or as the things that our research teams will help to create and put into practice. And when you've worked out what that P is that's best describes the thing that you want to implement, you also need to consider if it's an example of radical change, a breakthrough with far-reaching impact, if it's incremental change where small modifications to existing practices are needed, or disruptive change where you're planning on overthrowing existing things, as that will influence the actions that you need to take when developing and conducting your implementation journey. So now we've worked out the what, you also need to work out the why. And this isn't about your own wants or wishes or even perspectives about how something's important, but what the system wants from you and why that change is needed. And it's your job also as implementation practitioners to work out what that system is, because it might be a community group, it might be the NHS, it might be a local school classroom, it could be anything. That's up to you to work out what is that context in which you are needing to implement into. And so to work out all of this, you need to ask yourself why. And then, a bit like a parrot on your shoulder, you need to ask yourself another 4 times. So we'll say that if you keep asking why, by the time you got to the 5th time of asking that, it's both really annoying, but you've probably drilled down far enough to work out what the answer might be. And the reasons for change might be financial, or they might be about workforce, or they might be about suboptimal practice, or they might just be because there isn't something there already, and so anything is better than nothing. We need to understand the common factors that influence the likelihood for implementation, and see these are some of the common reasons that affect why something is implemented or not. So if you look at the factors in the middle column of the box, is it about something having high or low clinical risk, or high or low cost? Is it better or worse than current care? Are there lots of competitors or few or no competitors or competing products are there? Is your theory of change that you've developed complicated to follow, or is it really easy and clear? So it's these type of things that you need to build your case for change. Should also be said, each one of these can both be a barrier and a facilitator to change happening. So, for example, is what you're proposing too risky, or are there better clinical benefits than what is currently done? Is the cost of your new intervention too high or too expensive versus current care? And quite often you'll think about, QOF measurements, quality of life year adjust things, who would pay for it within our siloed health and social care system. You can look at current care, and is what you're proposing better? You need to work out what you mean by better than the current gold standard therapy that is supported by NICE. You think about who are the competitor products or companies. Is there an actual gap that you're trying to fit into? And if there isn't a gap there, should you be doing it in the first place? So some more questions to ask yourself. How will what you're proposing to do significantly change something, be it the patient's experience, the clinical pathways, the establishment of new standard of care? What are the clinical, social, and economic impacts of the thing you're trying to do? How will you measure these? How will you know that those impacts have been made? What are the changes in workflow that will be required? This might be staffing, resource and skills, or estate costs, or changing where budgets go. And how will this be resourced? So as a really good example here, a long time ago, I was working with a research team and they said, we've got this algorithm that can go into GP practice and it's free to use, and it will screen all patients and it will give the GPs a list of who's at risk of kidney disease. But it wasn't free to use because actually the algorithm didn't do that on itself, and it needed a member of staff, a nurse, who had to be recruited and paid for to go through that entire list and then to refer people into a particular self-management program. So even if something can seem free, it isn't always free, and it's our job to understand how what we're doing fits into the system and the unanticipated knock-on effects that it could have across that wider system. Then we also need to think about how the benefits of what we're trying to do can be spread across other organisations, different implementation contexts or sites beyond the boundaries in which we're actually working on. So in order to do that, we need a shared understanding of what we're trying to implement. So the question is, we all know what a hedgehog cake looks like, don't we? And we probably all had a hedgehog cake as a birthday cake when we were kids. But as these variety of different attempts show us, not everybody can make a hedgehog cake look quite the same as each other. And so in terms of our implementation understanding, not everybody has the same idea or same ability to implement that idea as everybody else. So was there a consistent implementation approach here? Clearly not, because you've got how many cakes? 7 different hedgehog cakes there. So what the variation in cake design tells us is that successful implementation doesn't just happen. Implementation needs a goal, so you have to know what you're trying to achieve. Implementation needs a plan, or you need a recipe to continue with the cake analogy. Implementation is a purposeful set of actions and a set of decisions or instructions. And if at first you don't succeed, you need to try and try again. But you cannot make the same mistakes as you did before. So it's very much a learn and change approach. So quite often when we're talking about implementation and how to get something into practice, we talk about what our theory of change is. So a theory of a change is a really fancy way of saying, what do you expect to happen? And it makes you think about what you have to put in, or your inputs or resources, what you're going to do with these or the activities, what you'll produce, your outputs, and what the results or outcomes or effects will be. And you can also use a logic model template to help you clarify your theory of change, which in turn can help you decide how you're going to carry out your implementation efforts. So a logic model can be whatever you want it to be. It can be simple, it can be complex. And this is just part of one of mine. It's probably quite simple, but it shows how we wanted to implement a particular approach to how we do implementation research in our ARC. But it's also really crucial to think about why you should have one, because this is what can happen if you don't have an implementation, a logic model or a theory of change. You kind of have no guide to send you in a particular way. Or this is a different way of thinking about it. This image shows you what happens if you forget to add one of the key components or don't do something, and how it can affect your change strategy. So the top line is what we want to do, but every other line tells you what happens if you forget something. So the ideal way is to have a vision, to have the skills to enact that vision, for there to be an incentive to change, to have the resources to enable that change, to have a clear action plan and to deliver that change. But if you don't have a vision, it leads to confusion. If you don't have the skills, or your team or the people you're working with don't have the skills to implement that change, it can lead to anxiety. If there's no incentive for change, then change will be slow or non-existent. If there's no resources, it will lead to frustration. And if there's no action plan, then absolutely nothing will happen. So the next thing you need to think about in developing your operational implementation efforts is to know your audience. And we talk about stakeholders, we can talk about consumers, customers, end users. There's a wealth of different terms we can use. There's quite a lot of academic discussion at the moment about what terminology should we use. People are starting to tie away from stakeholders, but for the moment, it's as good a term as we've got as any. So, Doctor Who, do you know who your users are, or your stakeholders or your clients? They might be like you, but they might not be like you. So how are you going to identify them? Because knowing who your audience is a prerequisite for implementing change. You also need to not underestimate the diversity of your end users. This is why we always recommend that you co-produce or co-design your implementations efforts with your stakeholders. You'll probably hear lots of people talk about co-production, co-design, involvement, engagement. There are so many terms that we can use, but they all basically mean the same thing. Have you spoken to the people that are going to be using whatever you want to create? and who are going to be affected by it, even if they're not using it. Because if they're not happy about it, or if they don't think it's fit for purpose, they won't bother using it. And if that's the case, you then need to ask yourself, why are you bothering to do all your work? So there are 9 C's in stakeholder analysis that you might want to think about. And these probably aren't exhaustive, but they're just 9 really clear groups. So there might be the commissioners, they might be customers, they might be collaborators or commentators, or the channels or the routes. They might be contributors, they might be consumers, they might be champions, or they might be competitors. You need to kind of know who each of those people are, and there will be multiple people in multiple boxes. Some people just be in one box. Some people or groups or organizations can be in many of those different boxes. And when you're thinking about what is the landscape or the context in which I need to support the implementation efforts into, this is some of the kind of the background intel that you need to have carried out to understand who is who in the environment that you are going to be working into. So anybody that's done a bit of sociology will probably have seen Everett Roberts' diffusion of innovations curve, which is incredibly old, but still incredibly useful. So Rogers used this curve to, weirdly, to explain how the implementation of the innovation of crop rotation. So how he could convince farmers to change where they planted their peas in their field every other year to increase, to ensure you had kind of crop yield, which these days it isn't rocket science because that's what happens all the time. But at the time it was a bit weird. And so it took a lot of convincing. But what he found was you had innovators or early adopters, people who were really excited about the science and were basically going to implement anything that an expert told them because it was just fun and whizzy and exciting. And these people, they're the really quick wins. And it doesn't really matter what you're going to do, they're going to support you anyway. Then you've got the early majority. So those people in that yellow section in the middle, they need a bit of convincing about why they should adopt your intervention or your innovation or whatever it is that you want them to do. The really tricky ones are the ones on the other side of the curve, the late majority and the laggards. You probably don't want to bother with the laggards because they're the people who, regardless of what you did or do, they probably aren't going to support something. They just don't have that mindset. They're just not interested in it. The majority of your implementation efforts, your engagement with them, the efforts that you take probably should be in that late majority section because they're going to need probably the most convincing, but are such a large group that are going to make it worth your while. This is a different way of thinking about supporting people. It's basically still an innovation curve, an adoption curve, but actually, rather than people being laggards or disruptors, you have people who are agents of stability, or you have people who are agents of change. And so you kind of need to work out who is what and have people on both sides. And it is your job as that implementation facilitator to bridge those two communities and try and bring them together. But in the spirit of working out what everybody wants, it's not the easiest thing in the world. And so there are lots of templates out there that you can find. This one is from a place that's now called West of England Academic Health, well, it's not called Health Innovation Network, West of England. If you wanted to look at Mark Reed's website, Research Impact, he's got lots of stakeholder templates too. So there are lots of these tools out there that will help you ask questions and then annotate the answers. So you've got it in one place and you can start to build your strategies going forwards. Once you know who all of your stakeholders are, you then need to do a stakeholder matrix. And again, there are lots of templates out there on different websites. We'll have some links to all of these materials on our own ARC website, or if you just do a quick Google, you'll find lots too. But what you really want to do when you work out who your audience is and where you should invest your time is try and get to those people in quadrant 4, so the high interest, high impact, because these are the people that are going to really matter in terms of supporting your implementation efforts. So once you've all done all of that, you then need to work out what your value proposition is. So why should they bother doing it? And you need to be able to convince others that they should support the thing that you want, the so what question. So we call this a value proposition, and it's just a simple statement that summarizes why your audience should choose to implement and use your thing. It should be communicated with the clearest benefit so that they, regardless if that's the individual or the organization, will be able to receive it and use it. So every value proposition should be contextually shaped, speak to your customers' challenges, and make sense for them. So in the most simple terms, will A, or this will help B do C by doing D. Will become a bit clearer as we go through the next couple of slides. But you also want to make sure you stand out from a crowd, because this is a really complex, busy workspace at the moment. So this is an excellent template. So our something helps somebody who wants to do something by something and something. So using those things that we talked about earlier about what is it you want to do, how you're going to get into practice, how is it going to make a change, who is your audience, can you now have a go? So something will help somebody to do something by doing something. And to give you a bit of a clue, this is one of the ones that we've done with a product that's come out of ARC. So the Hypos Can Strike Twice booklet, which is a self-management guide for people who have diabetes to prevent hypoglycemia. So if patients can access and read the Hypos Can Strike Twice booklet, it will help patients to change their behaviour and not call ambulances repeatedly by knowing how to manage their diabetes and prevent hypo attacks. So is that something that is feasible for you to do? So it's been suggested that 75% of implementation efforts fail through a lack of readiness. But how will you know when you are ready to implement your change? Knowing when to implement something, it can be tricky. We can plan, but sometimes you just have to get on with it and do the best you can. Sometimes circumstances can't be avoided, or equally, a situation presents itself which is too good to be true, even if you aren't quite ready. So in the last couple of weeks, we've had that. We knew that a general election would be called at some point this year, and lots of us thought it would be later in the autumn. But then suddenly, over a couple of hours, we were all scrabbling around thinking, oh, there's going to be an election announcement because the PM's going to make a statement. And then lo and behold, we are now for us, we're in Purda. So that's changed everything that we can do. Any of the comms work that we had planned for the last 2 weeks and the next 4 weeks can't happen at the moment because of the rules that we have to follow because we're government funded. And whereas we had a plan in place for how we would cope with that later in the autumn, everything's had to be brought forward really quickly. So sometimes the context, our delivery context changes, and we just have to go with what we've got, even if we aren't quite ready for it. So Cotter, this comes from a very old business school type management system, and Cotter steps 8 steps to presenting change. So you need to create a sense of urgency or build that need for why change has to happen. You should have a stakeholder group, champions, a community around you, a coalition of people that can help guide, coordinate, and communicate why that change needs to happen. You should have a strategic vision and initiatives that help you deliver that vision. So you need to clarify how what you're doing is different from the past and what that future will be if this thing can happen. You should enlist a volunteer army. So we know that implementation doesn't just happen, but we also know that if you remove the physical activity of that implementer being there, something needs to sustain it after you have stepped away. So large scale change, or even any change, involves all people moving in the same direction with shared ownership and consensus. But we also need to make sure that that ownership is given over to the people who are going to be using your change, your intervention, that thing, when you've stepped away. We need to work out how to enable change by removing the barriers. And actually quite a lot of those barriers to change you will have identified and hopefully put management steps in place whilst you were trying to work out what the context was and what the facilitators or what the barriers were. You need to be able to say what those short-term wins are and let people know, because that keeps them energized and engaged in what you and they are trying to do. Crucially, though, you need to keep going. And you need to make sure those connections between behaviours and successes are articulated. And so people know that all of this action does actually lead to some better outcome in the end. So we talked about earlier about fidelity to your implementation when we saw those hedgehog cakes. And so implementing change isn't a one-off action, but something that needs the attention constantly, so that thing can kept being used or adopted or embedded or normalized into a system so it's used as business as usual. But I think what's really crucial to understand when we saw those implementing hedgehog cakes is, just because if I'd said to you all, make me a hedgehog cake, the likelihood of it is that the cake would have been very different, as we saw in those earlier slides. So when we talk about building in implementation and building in sustaining that implementation, we need to understand that what that means will be different for each different implementation context, but we also need to start thinking about the fidelity of what we're doing. So ideally, you'll know what your what is, your how is, you'll know the enabling context. And then we want to talk about the implementation quality. And it's basically a recipe of what did you do in different places? Was it, you talked to some key people? Did you have some different resources? Did you have meetings? Was there a financial incentive? And all of those together will lead to those outcomes. But, and here's the really tricky but, we also know that the way we do that will change for your different contexts, those different delivery places. And sometimes it might mean that your intervention, the product, the thing that you're trying to get into practice, will need to change slightly according to the shape of the delivery place that you're trying to get to. So when we talk about the fidelity or the quality of your implementation, sorry, the slide's going too fast, you need to start thinking about, was it in one place, in the first place, was it implemented as you intended, or what had to change? Did it reach the people you were planning to reach? And what was the dosage? Or if you think about it in terms of the tablets somebody might take, how many times did you have to do a particular part of your implementation strategy to get a success? Did you or everybody follow your planned implementation strategy, or did you adapt it? And that latter bit is really important. So we talk about adaptive tailoring in terms of implementation. So you've got a picture there of somebody having a bespoke suit and a tailor, and it's, that whole, we have clothes that is the off the hanger, off the peg, or sometimes we have really bespokely made things. Equally, you can have an olive, and we all know what an olive is, but what are the constituent parts of the olive? Is it that it's this succulent flesh and it's got a stone in the middle of it? But actually, there are so many different types of olive, but we still use it by the same terminology. So it's your job as implementers to work out what is the thing that still makes your thing the thing that you have the evidence of. So if it was an olive, is the core fidelity the fact it's still got a stone in it, or is it the fact that it has green flesh? Is that really important too? So you have to know, because implementation happens in real life contexts, not static places where research can often take place. We're talking and we're interacting with people and systems that can behave in unpredictable ways outside of research context. So we need to know in most cases that we can implement our interventions, but they need to be tailored or adapted to the context in which they're going to be delivered. So to think about that bit even more, it's just past lunchtime. So these are the three key things. Implementing change is not easy, it's not linear, but messy and adaptive, and needs to be tailored to each implementation site. In order to do that, the implementers need technical and adaptive skills to navigate. But it's also important to know what has to stay the same, so our core fidelity, and what has to be changed to fit the different contexts or circumstances that we face, also the adaptability. So because it's lunchtime, let's think about, we were all going to make a cheese sandwich, or it could be ham sandwich or a smoked salmon sandwich or an avocado sandwich, but look at the variety of sandwiches on that screen. They're all sandwiches, but they are all different. So as implementers, we don't really just want to implement something in one place. That's not a productive use of our time, our efforts, or our resources. We want more bang for our buck, or more impact for our energies. But what we've seen is what you will do in one place isn't necessarily what you will do in other places. And so people talk about the scaling fallacy, or the tendency to assume that a system will work at scale in one place just because it will work in some other place. And that is one of the silliest assumptions you can ever make as an implementer. So this is a really useful checklist that comes from colleagues in Health Innovation Network in the West of England, about their scalability assessment checklist. And they're just a series of questions that you can ask yourself about your intervention. So a final checklist for you. These are I guess my top questions that I would ask our teams, and I would ask you if you were going to implement change into practice. Have you defined the problem or made a problem statement about what you're trying to address? Do you have a clear goal that is a solution to your problem statement? Are your outputs tangible and understandable and clear? Do you have outcomes that will be a direct consequence of the change that you want to implement? What is your threshold for change being established? So how will you know that what you have done, what you've said will happen, has been done? And tracking that impact and understanding when that impact is a really, really tricky thing to do. So how do you know the impacts of your outcomes? How will you know when they have been achieved? Especially as researchers, we quite often move on to our next project, and the impact of a piece of research that we might implement might not be known for 4 or 5 years afterwards. So how are we going to find out? Have you thought about the activities that you're going to need to achieve in order for your outcomes and threshold of change to be created? Have you made any nasty causal assumptions? So have you made some academic assumptions about the problem or the case for change? Or have you really consulted with those stakeholders in the end communities to make sure that what you think might be an issue is an issue, and then that the problem that you think you found, that the solution you're proposing fits that problem too? Have you worked out what the conditions are that are for success? So is it about a change in bed day behaviour? Is it about getting patients out of hospital quickly? Is it about reducing medication? Is it about reducing falls? What is the conditions for success that are needed? What's going to let all of that stuff happen? And then what are the resources that you are going to need to do that? So we know implementation doesn't just happen. It's about not only the paper or the incentives or giving people the things that they're going to need to implement that change, but it's also about the manpower behind that change, both of yourselves or your teams, or the manpower that is needed within the system to create that change. So there's lots of things to think about there. I'm going to stop sharing my slides now.